Hello, viewers. You're welcome to our enlightenment program that seeks to enlighten you on issues relating to your brain and spine health. My name is Dr. Ubong Ekpene. I'm a consultant neurosurgeon with the University of Uyo Teaching Hospital in Uyo, Akwa Ibom State, Nigeria, and a lecturer with the University of Uyo. In a series of videos on enlightenment, we had considered a very important and common symptom called headache. And we made mention of the fact that we have primary headache, which has no clear underlying causes. We also have secondary headaches, which had clear underlying causes. And we started by looking at one of the causes of a secondary headache. We started with brain tumors. We gave an overview. Then we delved down to a particular type of brain tumor called pituitary tumor, which arises from the pituitary gland, which is located somewhere deep in the brain. And we consider the fact that there could be functional type or could be non-functional type. Functional type tend to elaborate certain hormones, which are very important chemicals that help the body function well. And when they are produced in excessive quantity, can give rise to certain problems. So we looked at prolactinoma, we looked at growth hormone secreting tumors, and we also looked at the cortisol producing tumors. And today we're going to consider a very important brain tumor, also called meningioma. Meningioma is a slow growing brain tumor that tends to arise from one of the layers of the covering of the brain called meninges. There are three layers. We have the inner layer called the pia mater, the middle layer called the arachnoid mater, and the outer layer called the dura mater. And from the arachnoid mater, the middle layer, there are some cells called the arachnoid cap cells, which when they grow excessively can result in this tumor called meningioma. The good thing is that it's a slow-growing tumor and can be treated. What is the burden of meningioma? We want to make us realize that meningioma is a relatively common tumor. It tends to account for between 20 and 30% of all primary intracranial brain tumors. Primary intracranial brain tumors are tumors that arise primarily within the brain itself, while secondary intracranial tumors tend to arise from other parts of the body and then move to the brain to sit there. We will discuss that in another video, but today we are focusing on meningioma. 20 to 30% of all primary intracranial brain tumors. So what causes it? Many factors have been argued to be possible causes, but the ones that are very clear causes are: number one, irradiation, exposure to irradiation. Once there was a time where people treated ringworm of the scalp of the head with irradiation, and down the line these people develop meningioma. So it's been shown that there is a causal relationship between exposure to irradiation and meningioma. It's also been shown that there is some genetic predisposition. So patients who have a condition called neurofibromatosis type 2 tend to have increased risk of developing meningiomas. Other changes within the genes can give rise to predisposition to meningiomas. Trauma to the brain has been discussed in many circles as a possible cause, but this has not been confirmed. Same thing with viral infection to the brain, and even the use of cell phones. Some have attributed this to a possible cause or to be a possible cause of meningiomas, but studies have not yet confirmed this. So what are the risk factors, or what are the other risk factors that may result in this? You can consider something like age. It tends to occur amongst the elderly more compared to the younger people. It occurs at all ages, but the frequency increases as one ages. It also tends to occur commoner in females relative to males. in a ratio of 2 for females and 1 for males. It is also common amongst the blacks relative to other races. How does this tumor present? And this is very important that you know that in case you have these symptoms or you know somebody who has it. This tumor can occur or can present by irritating the underlying brain. And when this occurs, it can cause the patient to develop what is called seizures. In common man's language, it is convulsion, in which certain parts of the body shakes violently or the entire body. Patients may fall to the ground as a result of that. Patients may drool saliva from the mouth, may bite the tongue, may clench the teeth, may roll the eyes. And these patients also may present with headache. Remember, we're discussing causes of secondary headache, and this is one of the causes of secondary headache. Patient could also present with symptoms that arise from this tumor compressing the adjacent part of the brain, and whatever function that part of the brain serves may be impaired. So for instance, if it is in the frontal part of the brain, patient may present with changes in personality, which may reflect as somebody who was withdrawn now being very outspoken, or who was outspoken now withdrawn. Patients may have problems controlling urine. Sometimes the patient may present with symptoms relating to compression of the nerves that helps with the function of the eye. Patient may have visual defects, inability to see clearly or double vision. If it is within the area that controls smell, it can lead to inability to smell well or smell at all. Patient may present as if he has a stroke. One side of the body becomes weak. The hands may become weak, the leg may become weak on one side. The right side of the brain serves the left side of the body, and vice versa. So if somebody has this growth on the left side of the brain, may have weakness on the other side of the body, which may present as a stroke. So some of the known or causes of some of the presentations of stroke may actually be a tumor that is growing. It's very important that we know this. Sometimes it may present with problems related to sensation in the body, and there are other manifestations depending on where it is located, but we'll just limit ourselves to this because of the time space we have. So if a patient presents with this, either you have the symptoms or you know somebody who has it, then that patient should present early to a doctor. And that doctor would see you, examine you, take a detailed history, would necessarily, after confirming with a scan of your brain, send you to see a neurosurgeon who is the one who is trained to handle such a condition. And the good news is that it's a treatable disease, it's a treatable condition. Early diagnosis is key. And if you present in the hospital early and it is diagnosed in time, it can be cured, especially if it's the type that is what is called benign, not the aggressive type. Early treatment is the information, is the message that I'm passing across here. And early treatment can only happen if there's early diagnosis. So I want you to share this video to as many as you can, especially if you know somebody who has a symptom like this. It's very important that this person gets to know that he or she can be treated. In Akwa Ibom State here and in several other places in Nigeria, neurosurgeons are available to treat you. It's not a spiritual attack, it's not a curse from the gods, it's not a spell, it's just a condition that has happened and can be treated. So I want to encourage you, you can like this video, you can click on the notification button so that other videos as they pop up, you can be notified. Thank you for sharing. Have a nice day.